health is in peril. We need to eat proper food. Don't even get me started on the frozen food imports. Africa has become a dumping ground. I can't tell you how often, people would pass away from terrible things no one can explain. And it's what we're consuming. It's our sanitation conditions. It's a horrible healthcare system. What are we doing about that? Importing frozen food, frozen modified food. Everyone, welcome back to the Hearth of Thought. Today, I'd like us to talk about health because health is wealth. We can all agree. A healthy nation is a wealthy nation. And by healthy, I'm not talking about economic health, not today, but I'm talking about the health of the individuals. I'm talking about life expectancy. I'm talking about doctor to patient ratio. So we would like for Africa to rise. We would like for a reawakening, a rebuild. We would like for the African Renaissance. Everyone talks about that. We want the African continent to be the future, in terms of infrastructure, development, and all the projects that are ongoing. But there's one thing that we must understand. Who is going to rebuild this nation? Starving kids? Sick? Let's talk about it. Because right now, there's an influx of foreign nationals on the continent. Not that I'm against that. We can debate that separately. But it seems to me that the rebuilding that is going on right now, it's done by a ton of people, most of whom aren't Africans. And again, in terms of foreign direct investments, that's important. But what are we doing as Africans? How are we contributing? And how are our kids and our kids' kids going to contribute? So before we delve into the complexities of every other pillar of development, can we talk about health? The health of our nations. And I'm talking about the health of the individuals dwelling on the continent. What are we going to do in terms of keeping our leaders accountable? And I 100% agree with the people that say, well, when you go to the hospital, you should be treated first before, people ask for money and stuff like that. However, we must understand the complexity of the healthcare system across the continent and where we're at. So right now, over 300 million Africans are malnourished. Children in northern Nigeria are going through malnutrition crisis.
The baby was too malnourished. Doctors Without Borders says it has treated more than 70,000 children for malnutrition in Katsina State alone this year. At least 650 have died.
Just like Malawi are losing severely in their healthcare services. And this is just to name a few because we see this pattern across the continent. And we can separate the trends that we're seeing in the northern part of the continent versus the sub-Saharan Africa. But what is it when we talk about health? Why does it matter? In order for us to build a healthy Africa, in order for us to be able to engage in economic activities, in order for us to, engage in agriculture, infrastructure, and also the construction work, we ought to be healthy. We often talk about how youthful and vibrant the African population is in terms of demographics, but what are the numbers looking like in terms of our health? What are our health stats? Are we looking at people who would be prosperous in virtue of how healthy they are? Or, are we lagging? We must acknowledge that significant progress has been made. However, the numbers are still looking discouraging. When I think of the Sudan and everything going on there, the health crisis, the hunger crisis, and food insecurities, I can't help but wonder, how do we rebuild a nation when the status quo is looking like it's looking right now? So can healthy people or can unhealthy people rebuild a nation? Can a sick, starving, and malnourished population rebuild itself, rebuild its nations? And that trickles down to education. because in terms of productivity, we must understand that there's a degree of skills acquisition that must happen. And for that to happen, people need to be healthy. For a healthy kid sitting in a classroom, or for a kid sitting in a classroom to learn and grasp, he has to be healthy. Can a malnourished kid pay attention in class? Can a sick kid pay attention in class, let alone gain skills? I've heard this argument a lot where people say that, Africans are not as smart, but that's not true. We are smart. And you see this when, we transfer our skills internationally. You see all the brilliant minds and everyone that's excelling in different, works of life. And that begs the question, well, why aren't we putting that same energy back home? And that would delve us into institutions and everything regarding policy and investment strategies. But in terms of our generation and the future generations, it's difficult for kids to assimilate and learn when the conditions under which they're learning are hard. So it doesn't suffice to say that, but they're not as smart. It's like, well, are they even able to assimilate in class? Are they able to learn? And the answer is, if the climatic conditions are horrible, if they're malnourished, if the kids are, facing different health crises, water, sanitation conditions are horrible. People have to travel distances to get clean water. Like, where do you place education in there? Because I very much want us to have the education conversation and how we must revamp that to suit our context. But we must understand that we ought to be healthy for that to work. We ought to be healthy for us to be able to get to a place where we can rebuild sustainably. So in terms of, the indications for a healthy society, what makes up, what criteria do we use to consider a nation healthy? We have life expectancy, we have mortality ratios, we have infant mortality and maternal mortality, death rates, and doctor to patient ratio, and also access to clean water, sanitation, because all those things have a huge impact on health. We have the investment that has been done in the healthcare sector and nutrition rates, the quality of the food. We also have, other health stats like how infectious diseases are affecting a certain population, and vaccination rates and all of that, food security, and healthcare access, and a myriad of other factors or indicators. So what are we looking like on the continent, from an average or an approximate perspective? In sub-Saharan African average of life expectancy is 64 years compared to 77 globally, which we must acknowledge is a significant progress from the 2000s. And in terms of, the lowest on the list being Nigeria with 55 years in terms of life expectancy, and Seychelles being the highest on the continent with 75 years life expectancy. And life expectancy is generally the average age of a population, expectancy to die pretty much. So on average in Nigeria, someone would pass away at 55 years old. Can a 55-year-old person who passes away consider that kind of dead timely? I think not. And in terms of sustainable development, it takes time to rebuild a nation. And if we're passing away early, well, how sustainable is this work going to be done? So we must understand that right now, in terms of nutrition, over 30% of the kids that's 1 in 5 kids has stunted growth. And the worst cases being in Burundi, Eritrea, Niger, and you can see a trend in terms of countries in the Sahel and stuff like that. Anemia. 40% of women have anemia across the continent. This is on average. And over 300 million people face hunger on the continent. That's 300 million people. What is the population of Africa? For 300 million and more people to face hunger. Let's not even get into healthcare access. What is the doctor to patient ratio? The doctor to patient ratio is as low as 1 to 10,000 inhabitants on average. And what is it looking like in the developed nations? We have 1 to 200. You can see the gap. And we all know what it's like going to hospitals back home. We all know what it's like to see a doctor, and we all know the conditions under which we're being treated. There's a separate conversation about, well, should a hospital treat a sick person without, resources, without them bringing the money and stuff like that? And the hospitals would usually say, well, we're not covered. If we go about treating every single individual for free, then it's not going to be sustainable. The hospital's going to close down and we're not going to be able to operate. So in terms of, access to a doctor, and we're talking city dwellers, let's not even get into the remote areas, because that's another topic, because there's not even the facilities, there's no staff, and even, civil workers who are assigned to remote areas don't even go. And we can, again, discuss that, because they would say, well, where am I supposed to live? How am I supposed to, survive in an environment that has no facilities, no amenities? So a lot of things come into play. We must understand the complexity that we're plagued with, because one thing trickles down to the other. The doctor to patient ratio, it's not just a stats, it's real, because a lot of factors come into play. Training, access to good, universities. For a very long time, there was a stigma of HIV and AIDS, and I must applaud the work that has been done across the continent to combat that. A lot of health campaigns, even though behind those campaigns was hidden corruption and a lot of embezzlement. I just can't help but wonder, okay, I really want to applaud the work that is being done, but we still see in terms of communicable diseases, a lot is still, not being done in terms of access to the right information, in terms of access to the medical healthcare coverage, and in terms of our sustainable future. 70% of deaths are accounted by maternal deaths, or at least during childbirth. Why are we still in a space where 70% of our deaths are accounted for by maternal deaths? Let's not even get into malnutrition and the quality of the food. And all these things have a huge impact on the rest of the sectors, because we would have workforce shortages. We would have, not enough healthy people in the office. And also, when it comes to low healthcare coverage, only 40% of people have access to essential services across the continent. Healthcare is beyond just a sector. It's the motor that and the engine that would drive our nations to prosperity, without which we are unfortunately doomed, because it would take healthy people to rebuild the nations. We've seen a lot of work done on the malaria front, and we've seen, in terms of free mosquito nets being given out, malaria treatments made readily available or widely available. In terms of HIV and AIDS, we've seen the work that's been done to combat that, like campaigns and, distributions of condoms and stuff like that. Vaccinations that are, for most countries, I wouldn't say free, but if I had to pick polio, for example, many countries have been declared polio-free, Cameroon being one of them. I think in 2020, Cameroon was declared polio-free, and other countries. So what do we need? We need to strengthen our systems. We need to strengthen our systems, from community healthcare workers to the facilities needed and to the resources. I believe that this is huge and urgent need to focus resources on healthcare, because who are we building a nation for if we're not healthy? Again, that begs the question, well, because the elites get treated abroad, little emphasis is placed on creating a robust healthcare system, having, the national coverage being, important enough for every single person to be able to afford that. So if the elites get treated abroad, would they feel a sense of urgency to reinforce our healthcare system? If all the ministers and the doctors themselves and everyone else who can afford to get treated abroad, what happens to the person in the remote part of the country? So we must hold our leaders accountable. And we must, as a people, I strongly believe that we must put our foot on the ground and say, these are the things we need as a society. And this is what we would not accept. I very much like it when I see in the Western world, a person in a position of power that cannot meet up with. We see this in Europe a lot. That cannot meet up with, expectations or goals, and they would resign, or they'll be forced to resign, or people would demand that they be fired. That doesn't happen on the continent. When our leaders don't meet their goals, no one says anything. No one's asking them to step down. No one is asking them to give an account. They can come and say whatever, but people just carry on. We need to get to a place of society where when goals aren't met, people should be able to step down. And only us as a people can reinforce that. But if we let it go, the power will be seized from the people. And that's already what's happening. And it's so deeply rooted that I seriously question how we can come back from this. But it starts a conversation at a time. It starts a step at a time. And it starts with us even getting that acknowledgement and that awareness that, hold on, we elected you. We decided that you rule over us because we needed a leader, because we needed guidance, we needed leadership. And now you are not meeting your end of the bargain. So the systemic issues are there. And in terms of food systems, we can talk about importation and how, I generally would like to get into the GMO conversation and the quality of the food, because we're talking about health, the quality of the food, the quality of the imports, and the local production. Because how ironic is it that Africa has 60% of the world's arable land, and yet we import over 50 billion US dollars worth of food yearly across the continent. And this is just a rough estimate. It is probably more than this. How are we as people with 60% of the world's arable land? Because people would like to argue that, yeah, we do have land and not all of it is arable, correct. But of the arable land, how much of it is being explored? Are we practicing sustainable agriculture? Or have we abandoned that to, chase other technologies, which I'm 100% for technological advancement, but I'm thinking first things first. Our health is in peril. We need to eat proper food. Don't even get me started on the frozen food imports. Africa has become a dumping ground. I can't tell you how often, people would pass away from terrible things no one can explain. And it's what we're consuming. It's our sanitation conditions. It's a horrible healthcare system. What are we doing about that? Importing frozen food, frozen modified food. And in terms of agricultural practices, I've seen it firsthand where, the seeds that are being used to grow crops are also imported. People who do poultry farming, all those chicks are imported. So what are we doing? And there's an argument for GMOs, which is, to preserve the quality of the produce, just to get a more sustainable, produce at the end of the harvest, and higher yields, droughts, whatever. But what happened to the local governments regulating these things? How are we just trusting what we're importing? How is it that we as a people could feed the entire planet and we import even things as seeds because it's better? Why haven't we gone to a stage where we're developing our own technology where we can figure out how to improve on our agricultural practices to get to a place where we can produce healthy food that can sustain the whole population? Those are low-hanging fruits I believe we should be honing in on, and I don't understand why we're not doing that and why we're not demanding that be done. A lot of farmers are going through a severe crisis right now because they can't even produce sustainably. There's a supply chain problem, and the produce that gets bad along the way, and distribution and all of that. Who is responsible to ensure that we meet our needs in terms of ending hunger? These things get me very angry, and it should get every single person angry, because we have the potential. We have the potential. So who are we looking up to? The African Union? And please understand that work is being done, but not enough work is being done. And we're not thinking sustainably in the process. If that were the case, we would have ended hunger by now. with all the aid, with all the UN and the UNICEFs and everything, we should have ended hunger right now. But that's not what's going on. So, again, I would like for our community to not only accuse, but also brainstorm on strategies. What is the diaspora doing? Do we need to start, getting into food distribution? Do we need to come together, put our hands in deck and feed people? But that's not sustainable still. It's a good place to start. People have been doing that for centuries. We need sustainable agriculture. We talk about it every single time, but why aren't we seeing the evidence? When the war happens somewhere in the world and Africa starts crying, oh, we don't have wheat, we don't have this and that. Why? When we could be providing the entire world with food, we can all agree. So what are the obstacles? I would say our governments aren't investing enough in our healthcare system. And we would say, yes, there's national debt. Yes, there's not enough resources. But that will bring us into the conversation around corruption. Why are we prioritizing personal interest over national interest? Why are we so selfish as leaders? I'm trying not to say they, because at the end of the day, we're all responsible. But shouldn't we get to a place in life where we say, okay, let's focus on these things first? Trust me, if Africa did that and we sustained our cities, develop or diversified our economies, we would get to a place where people could steal and eat and get fat, and it would not even impact the average person because we would be that wealthy. But people are so short-sighted that they wouldn't even understand that, well, if we just in the short term sacrifice our personal interests and develop our nations, then in the long term we can enjoy it, or at least our kids can enjoy it. No, it's eat now, die tomorrow. I'm sick of this. I'm severely sick of this. And you should be too if you're watching this. So we need to focus on our health. We need to focus on getting ourselves in a good place. Think of the northern part of Africa, like the stats is completely different. Why? Because when you look at what is being done in terms of the healthcare, they have more investments or government spendings that goes towards healthcare services. Why? Because a healthy nation is a wealthy nation. We need clean water. We need access to healthy food, which again, agriculture. Because if we're all sick and we're all passing away early, then who are we developing a nations for? I mean, I know who could make good use of Africa right now. There's a massive influx. Let's not even get started on the neo-colonization that's happening right now and the trade deals that have been signed. I see all the, executive orders that presidents are signing up and down and signing deals with everyone and, getting into more debt. Whose back is this going to fall on? It's going to fall on the young people's backs. In the near future, we will look at our nations and be like, oh my God, these people left us in so much debt. Nothing is being done. Not only we get the debt, we embezzle it. We don't even get the work done. And we're left with sick and starving people. And it's important for us to understand the city dwellers, please, let's understand that the countries do not revolve only around the capitals, be it economic capital or political capital. People live in a country or across the continent in different parts. And we kind of lose that awareness that, there's people in some parts of our nations that, don't have food to eat, that don't have access to clean water, that can't even go to school. So before we even get to the education conversation, we healthy people sit in the classroom and learn what? Again, this is a call to action for us as individuals to gather whatever energy we have and stop saying there's nothing we can do about it. It's high time we kept our leaders accountable. We need things to change. We just don't need to talk about it. It's a good place to start, but we need to take action. Let's figure out what can we do concretely. Thank you for watching. And if you would like for a community to grow, for this community to grow, if you'd like to be part of a community that comes together to figure out what we can also do, then please consider subscribing, liking the video, and sharing it. And let's engage and figure out together what can we do. I know this sounded very maybe angry but I strongly believe that if we don't get to a place where we say enough is enough, then we're going to continue enduring. Kids in Sudan are going to continue. Don't even get me started on what's going on there. Northern Nigeria. The hunger crisis across the continent. And we would say, oh, well, Africa is on the backs of an unhealthy population. Thank you for watching.